Why standard rehabilitation fails shoulder injuries. You've had the massages, you've done dry needling, you've done endless amounts of band exercises, and you might even have had to have injections or surgery, and yet your shoulder still hurts. Here are a few reasons why. Oftentimes treatment isn't outcome aligned. In my opinion, the standard rehab model is broken. It's a process that has been built largely around appointments and not results. Clearly identifying what success looks like and reverse engineering from that outcome to wherever that person is when they walk in through the door is almost always missed. And because clinic models generally rely on volume, appointments are short. Let's say that they are 40 minutes on average. In my opinion, again, there is no way that you can dig into the complexity of the shoulder, consider the biological, psychological, and social components of an injury, identify the root cause, coach proper exercise technique, and deliver a progressive program that will actually make a difference within 40 minutes. Let's talk about the feel-good trap of soft tissue and cupping and other passive treatments. They can feel pretty good, and that feel-good factor usually lasts for about 24 to 36 hours. And then things will start to feel tight and painful again. All we're doing in that situation is borrowing time and not rebuilding function. These modalities have their place. They can improve how the shoulder feels, and that creates more favorable conditions for rehabilitation. But when they are used in isolation, they reduce short-term pain without resolving the long-term problem. The shoulder still can't do anything that it couldn't do before, and it's still missing the control, strength, capacity, and that's likely part of the reason that it feels as banged up as it does. You cannot restore long-term function by lying on a couch. The next one's lack of progression. The same band exercises, the same reps, the same intensity week after week. That is not a rehab program. The body will adapt to the stress that you place upon it, and then it stops because you're not asking any more from it. Tissue needs to be loaded in order to repair and grow stronger. The brain needs progressive movement challenges to restore control and confidence. Without those things, you just hit a plateau and you stay right where you are. We also need to think about poor adherence to training programs. Research has shown that in a worst case scenario, up to 70% of people don't do the exercises that they've been given. And there are a few reasons for this. Sometimes no proper program has even been provided. And I've seen stick men drawn on post-it notes and have it passed off as a rehab plan. There's no support between sessions, so when someone gets stuck, or maybe in some cases their symptoms worsen, they just stop doing the program and give up. There's rarely any guidance on fitting exercises into a wider training week, so just do these 3 exercises 3 times a day. That gets pretty old pretty soon. And let's be honest, the exercises that are often given are not even that interesting. Nobody is doing rehab for fun, yet programming is an art and a science. People have got to see the value in what they're doing and actually want to do it. Without those things, adherence is going to collapse. So let's talk about what actually matters. A qualitative research paper titled "Restore That Faith in My Shoulder" explored what patients actually needed to recover. It identified 4 contextual factors that drive outcomes. The first was understanding their condition. There's so many people that I talk to who've had surgery or been given a diagnosis and have absolutely no idea what it actually means. The second one is feeling believed and heard. The rapport, trust and confidence between patient and clinician matters enormously. You need to find the right person for the outcome that you want. Number 3, confidence in the plan. Patients need to trust the direction, not just comply with it. The program needs to feel structured, tailored and individual. Research has shown that if it feels at all generic, then the outcomes will suffer. And finally, timely progress. People got to see improvement. We can use objective testing and data to create accountability on both sides of the table. Function needs to improve and pain needs to reduce, and if we can get those things right, then the adherence problem is largely going to take care of itself. The paper's conclusion is striking. The relationship and context around rehabilitation often matters more than whatever the treatment or exercise prescription is provided. The way rehab is delivered matters as much as what is prescribed. And let's talk about coaching and prescription to finish. There is a meaningful difference between these two things, prescription and coaching. Prescription says, do these exercises. Coaching says, here's why you need to do those exercises. This is the goal we're working towards. and here's how we are going to progress it together in real time. Coaching will build autonomy, and it makes the patient capable, not dependent, and that is a layer which is missing in a lot of shoulder rehabilitation. So in closing, the exercises that people are given aren't always wrong. The framework around them usually is. We developed the Coach Rehab program at Dynamic Shoulders specifically for active and athletic people who want to live, train and compete with confidence and without pain. So all of this stuff has been intentionally built in. If you want to find out more, we've got a free shoulder assessment that you can take. It's 2 minutes long and it'll tell you what your next step should be. And you can also book in a call to talk to us and find out about how you can get back to living the life that you love.